Sometimes pregnancy causes the blood sugar to go up in women who do not have diabetes. This is called gestational diabetes. Women who have diabetes also need extra care during pregnancy and should discuss this with a healthcare professional when they are considering starting their family. What is diabetes? Diabetes occurs when the level of sugar in the blood becomes higher than normal. There are two main types of diabetes. These are called type 1 diabetes and type 2 diabetes. How does pregnancy affect diabetes? Pregnancy makes the body need more insulin to control the levels of sugar, glucose, in the body. Therefore, women with diabetes usually need more treatments to control their blood sugar when they are pregnant. If the diabetes is not well controlled during the pregnancy, this may cause harm for both you and your baby. Therefore, you will need more regular checkups with a doctor and to see a specialist during the pregnancy. This will help to reduce the risks and help you to stay well and have a healthy baby. What is gestational diabetes? Sometimes pregnancy causes the blood sugar to rise in women who do not have diabetes. This is called gestational diabetes. Gestational diabetes mellitus, GDM, is a term for diabetes which starts for the first time during pregnancy. It usually resolves soon after the woman gives birth. GDM usually starts in the second half of pregnancy. The risks of having GDM for you and your baby are similar to those for mothers who have known diabetes, such as difficulties with giving birth and a higher chance of needing a cesarean section. Most women with GDM recover after the pregnancy, but there is a high risk of it returning in a future pregnancy. Women who have had GDM are also at increased risk of developing diabetes in the future. Risk factors: women who have had GDM in previous pregnancies, where there has been a short time interval between pregnancies. Women who have had a previous unexplained stillbirth. Women who have had a previous baby with very high birth weight, 4.5 kilograms or more. Women with an immediate family member, brother, sister or parent, with diabetes. Treatment: GDM can cause serious consequences for you and your baby, but these can be greatly reduced by treatment. Treatment includes following advice about diet and physical activity. Medicines to lower your blood sugar levels may be required. The medicines may be tablets, for example, metformin, but insulin injections may also be needed. After your pregnancy, insulin and other medicines to control your blood sugar are usually stopped immediately after delivery. Most women with GDM recover after the pregnancy, but there is an increased 2 in 3 risk of it returning in a future pregnancy. Women who have had GDM are at increased risk of developing diabetes in the future. It is recommended that women with GDM: 1. Avoid being overweight. 2. Take regular exercise. 3. Don't smoke. 4. Try to avoid having pregnancies with only a short time, for example, a few months, between each pregnancy. 5. Attend the 6-week postpartum check and have a blood sugar test taken. 6. Have their blood sugar level checked each year. What are the risks of having diabetes during pregnancy? There are various complications that may occur. Preconception care and good blood sugar, glucose, control before and during pregnancy can reduce these risks. 1. Premature birth. Babies are more likely to be born early, before 37 weeks. 2. There is an increased risk of miscarriage or of the baby dying late in the pregnancy. 3. Babies tend to be a higher birth weight, and this may make giving birth much harder. 4. There may be too much fluid around your baby. 5. You may experience more infections during the pregnancy, and the infections may be severe. 6. There is an increased risk of needing to give birth by cesarean section. Thanks for watching. If you liked the video, please like and subscribe to our channel HC Tips for our supports.